Good evening, friends, and a warm welcome to the next edition of KK Med Talks, the Barrow Buddies series that we are having, talking about the person's voice. And I welcome you all to the 1166th episode of KK Med Talks today. And friends, for today, we have a very important topic to discuss. As we all know that newer highly effective anti-obesity medications are being used rampantly across the country, and a lot is being talked about them. But today, I think we'll pick up a very important aspect which needs to be learned for everybody who's on their medicine or people who are caring for people who are on these medicines, and that is what changes we have to do when we are handling these kind of patients. And a very warm welcome to our guest today, Mrs. Sandhya, who is a senior clinical dietitian at the Department of Endocrinology. She's been working with us for many years now and has a huge variety of experience in handling such patients. A warm welcome, Mrs. Sandhya, to the show
Good
today,
evening,
and
sir.
good evening, and thank you for accepting the invitation. And
Thank
we
you, sir.
have very less time, so let us get started. I think
Yes,
this
sir.
is a very important topic, and really looking forward to listening to Mrs. Sandhya today. So I think in the bariatric clinic, you have seen a lot of these patients who are on these weight loss medications. So, Mrs. Sandhya, my first question to you is: when someone
Yes, sir.
starts these medicines, what are your maybe top three priorities for them? What would be the top three things from a nutrition standpoint that you would want these patients to understand?
Yeah, I'll talk to them about mostly high protein diet with low carbs, low fat, and low cholesterol diet, sir.
Yeah. So I think that's a very important message. When these patients are there, it's just not that the medicine will do all the job. Diet is important, and what Ms. Sandhya is telling us is that she's going to talk to them about high protein diet, low carb diet, and a low fat diet. I think these are really important. But sometimes, in practice, the other day I had a patient who said, "Doctor, yesterday I forgot to eat, one meal in a day because I was not hungry and I was busy with work, and I only realized 2 to 3 hours later that I have not eaten." So, Mr. Sandhya, what would you say is minimal amount of safe amount of food that a patient must eat in terms of calories, in terms of protein, that is minimally safe, that they should be taking that much amount of food, otherwise they'll become undernourished?
Yeah, they can take at least 1,200 to 1,400 kilocalories, sir.
Yeah.
If suppose they want to they are missing their lunch meal, they can take a handful of nuts with healthy nuts. With that, boiled egg whites, 2 egg whites.
Right. So, yes, minimal is important, but then at the same time, what we are learning here is that it's not zero, as Mrs. Sandhya is telling us, 1,200 to 1,400 calories is something that, everybody should have. Right. Let's move on to our next question and trying to understand, as was mentioned, that protein is important. But we also know that protein, hits the appetite quite a lot. So, how much protein would you recommend to these patients so that, despite the weight loss, their muscle and bone is quite well preserved? And how do they take that much amount of protein? Because, with high amount of protein, they will have small appetite.
So protein will distribute 1 to 1.2 gram per kg ideal body weight, sir. Suppose their ideal body weight is 60 into 1.2 gives almost 72 grams protein. The whole day menu will give like early morning breakfast and major meal like breakfast, lunch, dinner. In between some healthy lentils or healthy sprouts.
Right. So I think the two messages that we're learning here, that it's not just the total amount of protein that's important, but it's also important to distribute that protein. We shouldn't be of the notion that in one meal we just have a lot of protein and then we are done for the day for the protein. So what Mrs. Sandhya is telling us, that we can distribute the amount of protein, and yes, per kg ideal body weight is what we need to calculate the protein. It's not the current body weight. Like if somebody is having severe obesity and the weight is 100, it's not that they have to take 100 to 120 or 140. grams of protein it is for their ideal weight for their given height. But again, I think the biggest question, that often patients would ask us is, which is an ideal high protein snack? What ideas do you provide to your patients in the pediatric clinic? What they should eat and what they should not.
Um, Mine is they can go for lentils there. So in this lentils, if they go for 25 grams of lentils, they'll get 5 grams of protein and fiber together. That gives you good satiety. Second thing, they can go for paneer, either a soy paneer or milk paneer,
Right. So again,
or some
lentils, vegetarian sources.
sprouts,
Anything else?
or they
Yeah.
can have
Uh,
some egg masala omelette, or some roti with rolled with paneer, or egg roll roti.
Sure. So I think again the message here is that we are focusing on lentils, sprouts, eggs, and some kind of cottage cheese, paneer. And then if we are able to take all of these with the way we take our usual meals, then these are easy to prepare, healthy snacks that we can use. And there are a lot of people who've joined us today, Ms. Sandhya, as I can see in the chat. Everybody is greeting you and listening to you. We have Mr. Ellen Govan, we have Mrs. Swapna Jain and Alvinder Kaur, who are greeting you and enjoying your important messages. Uh, so I think there's a question from the audience, and Arvinder Kaur is asking that we do talk of milk and milk products as an
Yes, sir.
important source of protein, but many people do not digest this protein. So, what will be the dietary advice that you give to people who say, "Doctor," or when we take milk or milk products, we have indigestion, and especially if they are vegetarian, the problem is even more. So, how would you counsel such a patient who's not able to digest milk but needs to have protein?
Yeah, instead of milk, they can go for curds, buttermilk, lassis, paneer. They can go, sir. So most of the obesity patient, they think they consume milk, they will put on weight. So they can go for low fat milk products. They are not. They don't want to have milk. They can have curds, yogurt.
Right. So very clear message again. Fermented forms of milk, usually the tolerance is better and digestion would be better. So a lot of options Mrs. Sandhya has given: curd, buttermilk, some kind of lassi. And for those who are worried about gaining weight by having milk, I think the important message here is that we can take, some kind of skimmed milk or a low calorie milk, which is also very, very helpful. I think just building on to this thing, sometimes dietary sources are not sufficient to take the amount of protein, especially on these patients who are on newer medications, which often reduce their appetite. So, what is your experience in using supplements, protein supplements, and what is your take on that? Should we use them, not use them? When do we use them? And what is your advice?
Is they can use for protein supplements. They want to replace one meal. They can use one meal replacement. So which contains good amount of protein, vitamins, minerals. Instead of skipping a meal, they can take as a meal replacement with good protein.
Right. So again, there is an option again that if you are not able to cook your meal, when you have difficulty in getting the right kind of protein, meal replacements are easy. These are especially very helpful in people who are staying in hostel, who are staying alone, don't have the facility to cook, and I think that's where you can use meal supplements as well. So yes, they can be used, not for everybody, but in selected populations, and it does really help. But coming back to the topic actually per se, and we're talking about people who are using GLP-1 RAs or these newer medicines like Ozempic, Mounjaro, or Wegovy, and these medicines do cause a lot of side effects. The GI side effects, the nausea, vomiting, reflux is something commonly that we see in clinical practice. So, what would be your advice from a dietitian point of view, from a nutritionist point of view, to reduce these side effects, the GI side effects? So, what would you advise?
From my side, they can go for some liquid diets, which are high protein liquid diets like chicken soup, clear chicken soup, dal soups, some smoothies, clear vegetable soups.
right? So that's an important message. So if you're not able to tolerate solid foods, you're getting vomiting and nausea, what Mrs. Sandhya is suggesting that you take liquids, but again, an important catch, it should be high protein liquids, options of soups and smoothies is something helpful. Any other advice?
So if a patient is not diabetic, they can go for tender coconut water.
Right. So again, liquids are easy to digest, and therefore, the GI side effects can come down. What I would also add is that taking smaller portion sizes so that you can avoid vomiting. You chew the food thoroughly so that you're not really, giving a lot of work to your tract to,
Yes, sir. Instead of
digest.
solid food, liquid food.
Right. And avoid, lying down immediately after taking the food. So at least give some time so that you can digest it before lying down, because again, reflux is more common the moment you lie down. So I think this is an important message, because GI side effects are fairly common with these drugs. I think another important question, that we have to often emphasize while prescribing these drugs, and when they come to you. So, which food groups would you predominantly encourage? So, what are the do's and what is the don'ts in terms of food groups that you suggest when you, see patients who are on these drugs?
So all the food groups they are supposed to take, sir. Especially when they go for cereals, whole grain cereals on millets are very good source of fiber. And when they go for millets, less in calories. They can go for pulses and lentils and low-fat dairy products, healthy nuts and seeds in controlled portions for healthy fats and for satiety. And they have to limit refined cereals, refined sugars, deep fried foods. Better to avoid outside foods.
So what I liked was that you mentioned so many options that they can and very few options that they should not. So I think that's
Yes,
an important message here, that you can eat a lot of things, as was mentioned, but again, you have to avoid the refined forms of foods. But I think the important underlying message is that no one food group should be ignored. As a healthcare professional, we would always say that all food groups are important, because you need nutrients of different types, which will be provided if you cover all the food groups. So no one is going to say that a big no for this. You take everything in moderation, and there's some that you can take a little more and some little less. Having talked about food groups, I think another important aspect that happens with these patients is constipation, because overall they're eating very less. And so, how would you suggest is the fiber intake in these patients? What should be the
so
fiber?
fiber intake, they can take daily one fruit. If patient is non-diabetic, they can include two fruits per day. Patient is diabetic, one serving, that is 100 grams. They can include at least 4 servings of vegetables per day, that is 400 grams of vegetables.
Right. So when you're talking of fiber,
And
it's fruits and
yes, sir.
vegetables,
And lentils and dals also.
and they also have fiber. So that's
Yes.
a very important myth that Mrs. Sandhya has cleared today, that we are not only talking of lentils as a source of protein, but they're also important sources of fiber, which is important. What is also mentioned very clearly is that having good proportion of fruits and vegetables is something that is really helpful. So with all this in mind, if you have good fiber, definitely the constipation aspect would be much less when we talk of using these drugs. Sometimes in practice, patients also come and ask about whether we can do intermittent fasting or keto diet, or can we skip meals when we are on these drugs. So what would you advise to those patients?
They should not skip the meal, sir. So instead of skipping a meal,
Right. So a clear message here is that we should not be skipping
uh,
a meal, but instead, what
yeah.
would you advise?
So they should not skip the meal. Those who follow the intermittent fasting, in that intermittent fasting also they should follow good protein diet with all macro and micronutrients. So
Right.
through proper diet plan, they can follow intermittent fasting.
Right. However, I would still be skeptical, because anyhow they're eating very less, and even if they have long gaps of no eating as in intermittent fasting, they can never really make up in the time when they're eating, because in the 8 hours that they eat, they may still not be able to get the amount of calories that they should, and then they will have nutrient deficiency. So I strongly would not recommend,
Yes,
intermittent
sir.
fasting while you're on these drugs. You mentioned about fluids being an easy way, and
Yes.
especially when they have nausea, vomiting. So what kind of
Vomiting.
fluids would you recommend, and how much fluids would you recommend to avoid dehydration and
So
constipation?
if there is nausea and vomiting, they can't go for solid foods. Every second hourly, they can take us 200 ml. So they can start like 7 o'clock with tender coconut or barley water. Then 8 o'clock, they can go for rice porridge or else dal soup. Or again, 10 o'clock, like 12 o'clock. They go and meet a dietitian. She will give a clear diet plan for liquid diet.
Agree. So there are options, and again, not taking large amounts at one time, distributing it, like Mrs. Sandhya said, every 2 hourly, maybe 200 ml is something which is important. And though these, liquids are there, what would be your advice regarding caffeinated beverages, the sugary drinks, alcohol, when these patients are taking GLP-1 therapies? What is your advice with respect to these kind of drinks?
They can go for black tea and black coffee, green teas. If there is vitamin D deficiency, better to avoid green teas and black coffee, uh, black tea. Other clear soups they can take, sir. Alcohol better to avoid those for empty calories.
Having said that, I think from clinical practice, I can tell you that when patients are on GLP-1 RAs, most of my patients will come back and tell me, Doctor, nowadays I don't feel like taking alcohol. And at this point, there are newer studies which are happening looking at the anti-addictive properties of these newer medicines. They are very effective in reducing the desire to take alcohol. So that's another plus benefit, because we all know that alcohol has a lot more calories than any other sugars. So yes, it does help immensely to also avoid that. And talking about another worry that often patients would ask, and we also as healthcare professionals should look at, when these patients are not eating adequately because of these newer medications, what nutrient deficiencies are you most worried about, and how would you screen about them?
Mostly protein, iron, vitamin B12 deficiency, folate, vitamin D, and calcium are common concerns when intake is chronically low, sir. A detailed diet history, that is 24-hour diet recall, identifies where the gaps, what are the nutrients are lacking.
Right. So asking the patient about the detailed nutrient history is something which is very important for all the healthcare professionals who joined with us. Yes, that is helpful, but yes, as Mr. Sandhya said, we're talking of protein deficiency, vitamin B12 deficiency, which is really, really common. And we should, sometimes even need to supplement these as medicines, because like in bariatric surgery, we often say after the surgery, patient needs to be on a multivitamin tablet lifelong. Very similar here also, when people are eating very less, this is something really important. Another important aspect about these drugs, these drugs are prescribed for people with obesity, but they're also prescribed for people with diabetes as well. So how does your dietary advice change in people with diabetes on GLP-1 RAs, whereas those who are only for obesity?
So patients who is diabetic, there is more emphasis on carbohydrate quality, spacing, 3 large meals, and 2 to 3 small snacks to prevent hypos or spikes in their sugars. And those who are on insulin, it's better to check their SMBG, their blood sugars, like fasting sugars, and after their breakfast, after their lunch, and the dinner.
Right.
And
So when
for
you have
obesity,
that, yeah.
sorry to interrupt, sir. If patient non-diabetic, only obesity, emphasize on high protein, low carb, low fat, low cholesterol diet, and they should avoid skipping of meals, eat on time, sleep on time, and they should not delay their meal to avoid metabolic instability.
Absolutely. So when you're talking of diabetes, we're talking of like a three meal, 2 to 3 snack pattern. They're eating on time because they're often on medications that can cause hypoglycemia. So we don't want that to happen. And for obesity, a strict disciplined life really helps them. And just looking at the comments from the audience, and Arvinder Kaurji is thanking you for your advice that you've given her. We also have Rekha Bhattara ji who's joined in, and she's asking us about usage of muesli as a fiber source. What would you say about that?
Mostly again, they are added sugars, sir.
Yes.
Instant
So
foods contain mostly instant food conflicts. Mostly these are added sugars and
simple
and
carbohydrates. So
additional.
definitely
Yes, sir.
they would increase your glucose value. So I would
Yes.
not recommend that here. And there's another question from the audience which is coming in and talking about kidney stones with the intake of calcium, or even if there is vitamin D deficiency. So I think this is a very big myth. What I must understand and highlight here is that the normal recommended amount of dietary calcium for somebody who's above 50, for example, a postmenopausal lady, would be about 1200 milligrams per day, which will come with 1.2 liters of milk per day. Many of us, it's impossible to have that much amount of milk, but at least that gives good clarity that that's the amount of calcium that you really have to take per day to maintain your blood mass. And if you're really going to have worries of kidney stones, it's more of a myth rather than a reality. And I'm sure Mrs. Sandhya would agree that many times patients are very worried about taking calcium in diet because of kidney stones, but that's not the truth. So,
Yes, sir. It's absolutely true, sir. It's myth.
right. And sometimes we prescribe GLP-1 RAs, and these drugs are to be given to patients who've got kidney disease or fatty liver disease or heart disease. So, what are your dietary modifications that you would recommend when these drugs are being prescribed to these kind of patients with kidney, liver, or heart disease?
In CKD patients, based on their stage, CKD 1 and 2, there is no need of that much protein restriction, sir. They can go for zero point 0.8 to 1 gram protein. If stage 3B, 3B, 4, there should be a restriction in protein and some minerals like potassium. Leaching methods, we will teach them. In CLD, fatty liver, weight loss must limiting fructose, like they should limit their fruits. Refined carbs and especially alcohol is particularly better to avoid. In cardio, uh, salt restricted diet, there is any fluid restriction they should follow with low fat and low cholesterol diet.
Agreed. So again, there are dietary modifications. I would suggest you consult your friendly neighborhood dietitian, who could guide you in detail about these. But yeah, specific food items may be restricted. Some may be allowed, depending on the underlying disease. And sometimes it's a combination. People with diabetes may also have kidney and heart disease together. And therefore, I think your doctor or dietitian should be able to help you with the right set of medicines and the diet prescription that you really need. And I think maybe before we close, one or two more questions we may have time for. Asking about, we just had a good holiday season, which is coming to an end. And most of these patients who are on GLP-1 RAs, when they go out for functions, maybe weddings or any kind of big buffets, or while they're traveling, what would be your real world advice to them? How do they manage food in these big weddings and, buffets where there's a lot of food? How should they be handling their weight and while they are on these medicines?
So they should not arrive starving while going for a family party or something, sir. They can have a small protein-rich snack before social events, like one handful of healthy nuts or salads, sprouted salads they can take before starting their meal.
Right. I think a very important point. Many times, there's a habit. Okay, today night there's a big party, so let us skip the lunch, skip the breakfast, reach there absolutely hungry, and then you would eat anything and everything, and absolutely the most unhealthy things. So what Mrs. Sandhya is clearly telling us, that we do not reach absolutely hungry in these meals. You have your usual meals before going to the party, so that you eat in moderation. You start with salad. You start with nuts or something which is good in protein, so that is something that is going to reduce your appetite. A few other tips would be that you choose a small plate rather than taking a big plate. That itself is the first step to make sure that you will consume less amount of food. Sip water regularly, avoid the sugary drinks, and don't have a lot of alcohol. I think moderation would be the way forward. I also look at the chat box, and there's a thank you from both Arvinder Gorji and Rekha Batara madam for your advice. But there's another question, which is about fatty liver disease, and can that cause less appetite? So maybe if I answer that, so fatty liver disease per se has a big spectrum. In early stages of fatty liver, where there is only fat accumulation, the patient will be absolutely asymptomatic. It is only in later stages when they do have, kind of getting into fibrosis, the liver function is abnormal. Yes, definitely. Any cause of chronic liver disease at that stage would cause reduced appetite. So, fatty liver disease in early stages, no symptoms. Later stages, it can cause loss of appetite. And if you have loss of appetite, you should definitely see your doctor and find out what is the cause. Sometimes it may be simple metabolic problem. Sometimes it may need much more deeper evaluation. So I think with this, maybe if I have the privilege of asking the one last question to Mrs. Sandhya before we
Yes, sir.
close today's session, and that's about you know what would be your takeaway, or if I was to say three daily habits that a patient with GLP-1 should, walk out after having consulted you. What would be your those three mantras that you will tell to a patient on GLP-1?
Low carb, sir. High protein.
High
Eat
protein.
on time. Sleep on time. Don't skip your meal.
Lovely. So Mr. Sandhya has made it five, and very well, important. So definitely high protein, low carb, low fat, eat on time and sleep on time. Very, very important, messages that I think if all of us follow, whether on these medicines or not, I'm sure it will add good quality of life to all of us. There's a big thank you from all the audience who've joined us. And thank you so much, Mrs. Sandhya, for joining us.
Thank you, sir.
Can we have a certificate for today?
Yes, sir.
Great. So thank you again, and we look forward to having you back on the show sometime in future again. A lot of people are congratulating you for the nice session and really enriching knowledge that has been imparted. Thank you, Mr. Ravi M, also for your comments. So thank you so much, and goodbye.
Thank you, sir.